Hi everybody, welcome back to yet another video. Today we're going to be talking about festoons, which are normally referred to as lower eyelid bags, or sometimes those swollen mounds on the cheek, and what we're doing in 2022 to treat them. A lot of people think that lower eyelid bags and festoons are the same thing. However, they're very different. Now, the first main difference is the cause or etiology. Festoons are actually the result of sun-damaged skin on the lower eyelid and the cheek, as well as underlying contrasting muscle forces over the span of a person's life. And lower eyelid bags are actually an age-related fat pad that is protruding through the skin. And the second difference is location. So the lower eyelid bags are usually always found directly under the eye near the lash line, and festoons are actually seen more so on the upper cheek area and slightly into the lower eyelid as well. The third difference is feel. So festoons are often squishy, and when you press on it, it can kind of move side to side and migrate, whereas lower eyelid bags are firmer and they almost feel deeper beneath the skin. So what we've typically done to correct festoons is, through surgery, filler, lasers, and microneedling with radio frequency. Now, with all these options, there are some that work better than others. Now, when it comes to surgery, although it's very effective for the lower eyelid fat pad, in terms of treating or surgically removing a festoon, it can be a little bit more complicated, especially when you're cutting skin around the eyes. It's a very delicate area. This is a more invasive procedure, and it takes a little bit longer to heal. And filler, when done correctly, can give a nice result as well when you fill in some of those hollowed out areas that come with age, especially in the tear trough. And if you fill in small amounts around the festoons, sometimes it can give an illusion of a softer or smoother appearance. However, sometimes when you're animating yourself and smiling and talking, filler can tend to make you look a little bit more augmented than people really want. Lasers are exceptional for transforming the skin, especially when you're building new collagen and tightening the epidermis. This can really help a lot. However, most lasers are just not equipped to get as deep as they need to really break up the fluid that's causing that festoon. And the last option is microneedling with radio frequency. Really titrate your settings to get to the specific depth that you need to reach in order to break up that fluid. Now, there's a lot of people out there that will argue that a lot of the devices with RF microneedling are either very comparable or very different. Now, if you ask me, in my experience, and I've used a couple of these devices, I've used Morpheus 8, Infini, and EndyMed's Intensive, and I have to say I've noticed a very subtle, better improvement with the non-insulated needles. So non-insulated needles, I think the only company that makes that is the EndyMed Intensive, but I've just seen some really good results with that device, especially for if we're just talking about the festoons. Of course, everybody's gonna vary a little bit in their choice of settings. However, I have noticed that I really need to reach either 2 or 2.5 millimeters in depth to really get the outcome I'm looking for. And this is usually 3 to 4 treatments once a month. And this isn't just a treatment that I'm doing. There are many, many top dermatologists and plastic surgeons all over the world that are now performing this with great success. Thank you guys for joining me. And if you are in fact struggling with these festoons and you've maybe been holding off because you don't want to undergo surgery, then now is your time, because this is non-invasive. There's absolutely no downtime. No one's going to know that you've had anything done aside from the initial redness or erythema from the treatment, which subsides in 20 minutes. There really is nothing else you have to do. So if you have any questions, leave it down below and I'll get back to you. Until next time, bye.